This is Dave Monk of Prairie Monk, WEFT Champaign, 90.1 on your FM dial.
And Dave on the board. This is Sunday, February the 10th, 2019, and this is the Prairie Monk program, WEFT's weekly look at rails, trails, greenways. Once again, they're not green, they're white. If you get a chance to look outside, oh my gosh, it's gorgeous. And this is a really good time to shovel it because it's still light and fluffy. It hasn't started to get hefty out there.
We have two guests today. Basically, we wanted to say something about vaping, but these are two people that have other interests too. Now, Thalia Shaw is with the Health District, Champaign County Health District, and I'll get her to say something about what she does more generally. And Scott Hayes has got several hats. He works with the Sangamon River, but he's also been doing research with young people, and we'll get into that. Yes, why don't you introduce yourselves and tell us what you do, more generally, for instance, with the Health District.
Sure. So I'm a health educator at Champaign-Urbana Public Health District. So what I do there is I go out into the community and I do community health education programs. And our main focus this year is actually with teen pregnancy prevention and STD prevention. Mm-hmm. So I do a lot of work in the schools on that topic. And then I also, we work on tobacco and e-cigarette policy and prevention.
Yeah, I was very interested when I came here first that the teenagers were allowed to continue school. It was Ed 2, which was an independent agency for the school district. Yeah. And I was pleased to see that these people didn't have to drop out. And so I appreciate it. You gave a very good talk at the city meeting just a little while ago, and it inspired a lot of other debate, including the providers of vaping facilities, which we were talking about, and it's a major concern. Scott, why don't you say something about what you do and why?
All right. Well, I'm Scott Hayes, and I work with the University of Illinois at the Center for Prevention Research and Development. Been there about 20 years now, and I originally started with some research around tobacco policy and laws that regulated smoking in indoor public places. Mm-hmm. And as a result of that work, got involved with the Champaign-Urbana Public Health District, who was interested in passing such a law in Champaign, and then eventually I worked with the Coalition CU Smoke-Free Alliance, and we made our restaurants and bars smoke-free here in Champaign, and I've been working on the sort of legal and policy approaches to keeping tobacco, alcohol, and drugs out of the hands of young people kind of ever since. And we also do the Illinois Youth Survey, which surveys young people on drug and alcohol use and other behavioral habits, and I'm part of that project as well.
I'm Australian in background, and Australia was one of the first countries to systematically ban tobacco.
Now, if I'm not mistaken, Dave, Australia has a law, I think I've seen this, about tobacco packaging, where like half the pack of cigarettes has these really awful images of rotten teeth and black lungs. And
there are quite a few countries with that, those regulations in place.
The problem at the moment is that the Aboriginal population, probably they grew up some using smoking as a ethnic thing, but they're in poverty situation often, and there are a number of different situations that make tobacco their release, and they die 10 years younger than the average population, and it's a real concern to Australians at the present time. And So say something about what you're doing, and I'll listen quietly. I have to say that I took a walk on the basin just last night, and outside the big buildings that have just been building, looking over the detention basin, there are hundreds, perhaps thousands of cigarette butts, and that's probably because there are a lot of Asians in that building, and they seem to smoke, and so that intrigued me.
It's very interesting because I think one of the things that as tobacco regulations have gotten stricter in the United States, what we've heard is that tobacco industries are making more of an effort to penetrate other countries where regulations may be less strict, particularly China and other Asian nations. And I mean, Talia may have more information on that.
I'm also intrigued by the fact that the last bastions of resource for smoking are usually musicians. I can go just up the road where musicians practice, and there are cigarette butts, and you have to almost say you're going to live 4 years less.
Yeah, that was very interesting because when we were working on smoke-free bars and restaurants, it was like the musician community. There were these closet musicians that were really anti-smoking. One was Geraldo Rosales, who was on council. He was a trumpet player, and he was one of our staunchest advocates for smoke-free, but he was actually one of the very, very few Champaign musicians to really come on board against smoking in indoor spaces, but because he was a horn player, he needed that good lung capacity.
My understanding is he lost his seat on the council pretty soon after he voted against smoking in the buildings.
He certainly did.
Yeah, that's too
But
bad.
we like to say he voted for clean indoor air.
Well, exactly. But then again,
Yeah.
within
He did lose his
years
seat,
after,
yeah.
within years after that, it actually did get passed.
Yes, that's very
Thank
true.
you. Appreciate it.
I will say Scott and I met actually on our Champaign County Tobacco Prevention Coalition, which is our coalition that we've had for many years, at least since Champaign-Urbana was going smoke-free. And so that's kind of how we got introduced, and we've done a lot of work with tobacco prevention, but lately it seemed the trending or the topic that is at the forefront of our grantors' minds is actually the e-cigarette epidemic that's going on right now. So we've started shifting a little bit more towards e-cigarette policy and e-cigarette prevention. So that's what landed us at the study session here in Champaign. Was we worked with a group of seniors at Centennial High School to create an advocacy presentation for the Champaign City Council that would encourage an ordinance to be passed that would prohibit e-cigarettes in the same places that cigarettes are prohibited. And that was through, we used a curriculum that Scott had a hand in developing called Engaging Youth for Positive Change. And so we went to the city council meeting, and the students presented their findings, their passion for the topic, and the council agreed that it was an issue that they needed to look into further. Fast forward to this past month when they did the study session that you were in attendance at. So
it would seem that there was some concern about high school children, and Unit 4, is it, that has been concerned about that, and I think seeking students themselves to look at this problem.
correct, yeah. So that's what we were working on with this program at Centennial, was talking with the senior level government and civics class about e-cigarettes, and then helping them to develop a message to take to the city council. And so that's where the city council got the inspiration to do the study session on e-cigarettes, was from those students.
So tell us a little bit more about what you would tell the public. You're on the air, and this will go to television. So tell the public what you would like to tell them, as you did to the city council. It involves the instrument itself, the strength of the material in it. Just give us a small summary of your concerns.
Okay, so e-cigarettes are a typically battery-operated device that aerosolizes a liquid for a user to inhale and exhale the way they would a traditional cigarette. Most liquids that are put in e-cigarettes contain nicotine, and many of them contain high dosages of nicotine, especially the type that we're seeing teenagers use most frequently, which is the Juul. And so our main concern from a public health perspective is the dramatically increasing rate of minors, so middle schoolers and high schoolers using e-cigarettes and becoming addicted to them the way teenagers used to become addicted to traditional tobacco products. And so
it's a sort of gateway to other drugs also.
they are actually, there's some preliminary research that's showing that young people who use e-cigarettes are more likely to eventually try traditional tobacco products because they are getting addicted to that nicotine on the e-cigarette and then potentially seeking out other sources of nicotine, from other products like cigarettes. So
The industry was there, the people who sell vaping equipment and vaping drugs, and they are sympathetic to what you're trying to do. So there was some question about whether this should be sold at the local gas station or sold only at certain places, so it would be known that this wasn't the gas station just around the corner from the school.
right.
There was also an interesting piece that said that this vaping, the fumes that come out are like secondhand smoke. And I think the mayor was kind of surprised that this was also scientifically obnoxious. So it is kind of secretive. You could almost have a cell phone with vaping typed into it, and you can't tell whether you're vaping or not.
Right, we're actually seeing that in the high schools. Students are, we've heard of students using e-cigarettes in class without the teachers noticing because they're able to sort of discreetly inhale them at the back of the room and then hold the vapor in their mouth until it dissipates. And so definitely schools have some concerns with their how Juuls especially are very easily concealed.
Scott, can you add to that?
Lots of just on that last note, some of the things I've heard from some of the teachers have been that, I mean, these are like the size of a USB drive, the Juul. So when we think of e-cigarettes, we think of a device that's approximately the length, if not a bit longer, than a traditional cigarette, which would be kind of hard in a school. But these are a lot smaller, and so kids can have them in the palm of their hand, and it doesn't emerge. And so I realize we're on radio, but you could put your palm up to your face, never see the device, and consume it. So you pretend like you're coughing and clearing your throat. Take another drag off of your Juul. And so unlike tobacco, and I was just having this conversation, like a young person couldn't smoke a cigarette in a classroom. Why? Well, because the smell is immediately obvious. You have to light it with a cigarette lighter of some sort, and the smoke is a lot more prevalent because it has a lot more particulate matter. Juuls are none of those, very easily concealable, and the danger, as far as Talia stressed, is that nicotine content, because one of the things to remember is that nicotine is the key carcinogen in a tobacco product, it's also the main and primary addictive substance in a tobacco product. The other stuff is very harmful too, particularly in traditional cigarettes, but it's the nicotine that's causing most of the cancers, and it's the nicotine that will addict people to where they cannot quit. And if this is happening at a young age, just want to say one of the things about brain chemistry that we know is that the younger you get a person started, and this would be true if it were opioids, it would be true if it were marijuana, cocaine. The earlier you get a young person started, the more it affects the brain and brain development, and the longer that addiction is going to last through their lifetime. So if we can postpone age of first use, that's a key device. We've done it with alcohol, and Champagne's thinking about it with tobacco, and that's where Tobacco 21 might come in, which we could also talk about if you'd like. So
Yes,
there are a few other things.
Say
but-
something about 21.
So Tobacco 21 is kind of a phrase that we've used in the advocacy community just to say we're raising the purchase age uniformly for all tobacco products, vapes, e-cigs, and everything else to 21, where currently it's 18. So one of the things we want to do is treat tobacco like alcohol, so that you would have to be 21 years old to purchase. So this is getting, controversial, as everything does, and a lot of people say, well, a young person can get married at 18, a young person can serve in the military, so why can't they? Same arguments were about alcohol, and yet the important thing to remember is this brain chemistry and these addictive processes are far, far different when we think about these kinds of devices. And the thing to remember is that when you're an adult, you can make the choice. Nobody's restricting that.
Well,
to push
the
you back
adult
that age.
end of it was interesting too, because adults use vaping in an attempt to get rid of smoke, but it stays around, and I don't think they lose their addiction by doing that.
So they're still looking into e-cigarettes as being a form of tobacco cessation. There's reason to believe that that e-cigarettes are going to be obviously less harmful for a smoker than traditional cigarettes, and so there's some sort of harm reduction discussions going on, at least in the public health community, about if an adult is a smoker and they switch completely over to e-cigarettes, then they are reducing some of those risks associated with the traditional cigarettes. But we do not want to see people who have never been smokers or who are using both tobacco and e-cigarettes at the same time. We wouldn't want to see that happen because obviously if someone is not currently addicted to nicotine, we don't want them to begin using it. And that's what we're seeing with teenagers right now. So they haven't been approved as a cessation device by the FDA. There are multiple other, forms of cessation, like the patch, the inhaler, the Chantix, prescription medications that have been approved for cessation. So until e-cigs are approved for that purpose, you probably won't hear anyone, at least in the healthcare community, recommending it for cessation, but definitely recommending it as a step down in terms of the harm involved, if that makes sense.
Yeah.
Yeah, I'd like to direct your attention, Dave, to the little chart. I gave Dave a graph, and this graph shows the reduction in self-reported cigarette smoking among high school seniors, and there's a trend line here that starts in 2008 and runs through 2018, and this is from our Illinois Youth Survey at the Center for Prevention, Research, and Development. And this trend line shows a progressive decline every year from 2008 down to 2018, and reflects the advances that the public health community has made in both changing the laws and in messaging around tobacco use. So I see reductions from about 21% in 2008 down to about 5% in 2018, steady decline every year. And yet, Then when we started asking about e-cigarettes, and we didn't start doing that until 2016, we recorded about 18% use, way higher than regular cigarettes. And then we see this huge jump in 2018 up to, I think, 28% in 2018 of e-cigarettes. So basically, the statement that this thing directs your attention to is we're far higher than last 10 years of cigarette reduction. I mean, we've gone backwards in nicotine reduction among youth, even before 10 years ago, in this quick of time, in this short span. And that's real concern to anybody interested in healthcare, young people's health, for all of these reasons that we just talked about. And this product shows no signs of really going away until we have some fairly serious regulation. And we hope to see that soon. But that chart's a real eye-opener.
Can you say something about the strength of the solution that goes into these little capsules that are then used for vaping? Because it seems that some of them are very, very strong.
I'm not 100% on the average amount of nicotine that you'll find in a capsule, because they vary from brand to brand, flavor to flavor, what company you buy them from. But I can speak about the nicotine content in the Juul, which is the device most used by teenagers. Juul, you buy the capsules as is, whereas at some places you're able to go in and sort of mix and match and refill and choose your flavor, choose your nicotine content. With Juul, they're already pre-packaged, pre-created for the Juul device. And those liquids are the same amount of nicotine as one pack of cigarettes. So you're able to, these young people who are maybe going through one Juul pod or capsule per day are getting the same amount of nicotine in that one capsule as they would if they smoked an entire pack of cigarettes. So that is obviously very concerning. And as far as I know, there are no replacements for that. It's just you use the Juul pods for the Juul device, and that's it. You can't alter the nicotine content.
So where does the internet come into this? Is it much easier for students to get hold of this material through the internet? But I also know that it's allowed them to be more educated. They've become their own power in a way. So is this something that the students themselves can get involved in, using the internet, using their growing ability to access information?
Well, I can, because we asked some of these questions on our Illinois Youth Survey. We typically ask about your sources of substances. We haven't asked a source question directly about e-cigarettes as at this point, but we know that the most common source of both alcohol and tobacco and marijuana for young people is either A, a friend gives it to them, or B, a brother or sibling gives it to them, or they steal it or take it from their parents, or their parents give it to them with their knowledge. So really, we haven't really, I mean, in essence, I guess the quick answer to your question would be maybe they don't need the internet. I mean, they're primarily using, so I mean, currently right now an 18-year-old bud can run down to the mini mart and buy a Juul. I mean, unlimited, much as they want. So that person can then, of course, an 18-year-old is a high school student, so that person in a high school can either resell or just simply hand out or give to their brother. It's one of the primary reasons we want tobacco 21, because the likelihood of a 16-year-old knowing an 18-year-old, both in high school and an older sibling living in their home, is very high. Once a person is 19 or 20, the older siblings are off to college or maybe otherwise on their own or at least living out of the home. So this idea of 21 has a lot of good benefits because of that, because a young person, they can still probably access it if the age goes up, but their accessibility is a lot lower. And another thing, Dave, I think you mentioned I'm really in favor of is restricting where these jewels are sold. So if we could get them out of convenience stores and mini markets and gas stations, out of the mall kiosks, and into legitimate tobacco shops, and even the owners kind of support this. It's what we did with tobacco. We said you can't smoke anywhere except in a tobacco shop. Adults can still access the product. That's exactly right. I mean, that's perfectly legit. You can smoke in it, sample the product, adults can access it, but young people are far less likely to walk in the door of a tobacco shop or an e-cig place or anything like that. Age restrictions are much more easily applied in those kind of places because there's no other reason to go into the store. Of course, a gas station, I'm coming to buy a Snickers bar, and I think I'll pick up a Juul while I'm here. Well, you're not going to do that in a tobacco shop. So there's some really key, simple policy changes. Keep them in the hands of adults if that's what we want to do, but would have strong effects on getting these out of the hands of young people, which is really all that we're interested in doing.
Is this a groupie thing? Oh, sorry, you're going to say something.
I was just going to say, I will say that we will need buy-in from all tobacco or e-cig vape shop owners to crack down on that, though, because I do work with teenagers a lot, and I have spoken to them about how they are accessing their Juul products or their e-cig products, and some of the places that I've heard them speak of are actually smoke and vape shops where they're able to just sort of walk in with their Juul, and the employee assumes that because they are possessing a Juul that they must be 18, and so they are not carding for the liquids that they're purchasing. And so we need to have everyone on board with the importance of carding for these products. Otherwise, teens are resourceful and they're going to find out which places in town are easily accessible, and they can, they don't need to worry about those age restrictions and whatnot.
Is this a groupie thing? If I go out into the community, there are small towns that often have a drug involvement. Is this a place where vaping becomes a teenage associate sort of thing?
It seems like the rates are so high right now that it's affecting all teens and not just a certain subset of them. I think that we're seeing all different types of folks using e-cigs. It's just one of those things that's trending, and it's they're easy to come by, and teens don't realize the effects that they're having. They think that they're just harmless water vapor, and that they don't, there's no concern with what's in them. And that's another reason why stricter regulations are going to be important, because without regulation, it sends a message that these are totally safe and they don't have to worry about becoming addicted or what the health effects may be, because they're not treated if they're not treated the same as traditional cigarettes, then they're going to be viewed as a harmless product.
Where does the medical community sit in this debate? The medicos were often the last to leave smoking. Mm-hmm. Nurses were late leavers also. And there should be some knowledge of, I think nurses are being accused of being overweight, possibly because of things like smoking behavior. So is there a science that comes from the medical community that can communicate with the teenage community, which is pretty well educated? Yeah,
we're definitely working on that. The e-cigarette products are really very new comparatively. They've only been, on the market in the U.S. for a little over a decade, so the amount of research that's been done is not, sufficient yet to come to a very clear conclusions about all of these questions that people have.
I walked out of the city meeting, and I came around the corner, and there was a vapor guy standing outside the
Right.
Seven Saints, and we had a long conversation, and he said, "This is no different than 10 years ago. There's nothing being done."
Right. It's just such a new product. There's just not. We're in the throes of it now. There's definitely a lot of research and a lot of discussion being done now, but it's fairly new, and so we're not quite there yet. The way that we are with tobacco in terms of very solid information, solid research, but preliminary research suggests that there are concerns about secondhand exposure to this. I mean, they've found carcinogens, they've found formaldehyde, heavy metals, volatile organic compounds in these devices, both in the inhalation of them and also on exhalation, so secondhand. We know that they can aggravate respiratory conditions like asthma, in bystanders. It's harmful for pregnant women. And so there's definitely reason to be concerned about the product. And of course, the Surgeon General has come out with reports recently in support of things like clean indoor air efforts, which is what we've been trying to work on here in Champaign. Just a matter of sort of denormalizing it and not, stepping way back into the past where we've gone through this before with cigarettes. And we don't want to see all of those years of education. We don't want to see the same thing happen with e-cigarettes that we had with cigarettes.
Who are you getting kickback from saying, oh, we don't need to regulate this the same way now that we do cigarettes because we don't have all of the evidence yet? If the evidence is already leaning toward this being effectively as bad, who would stop you from just stepping in and saying, we need to do the same thing with vaping that we do now with tobacco products?
I will say that we do know that tobacco, like cigarettes, are worse than e-cigarettes in terms of the harm they cause. People who are sort of against the regulation or against sort of jumping the gun on doing things similar to the way we do them with tobacco. I'm just going to go by my most recent experience with that conversation, which was at the study session. There was someone who I believe uses e-cigarettes who expressed concern about sort of regulating too quickly before we know all of the facts. And of course, we can go either direction on that argument. But from a public health standpoint, we know, we'd rather get ahead of it now, and then once we have more information, then we can tailor it. But we'd rather be ahead than behind when it comes to health issues. So
I think in a lot of cases it's about, politically speaking, it's about show me the money. I mean, there's an awful lot of money to be made in this industry, as we know, and the industry can say that they're not interested in, they want to prevent use by underage people, but their most viable customers are younger people, because the younger they start, the longer the addiction and the longer their customers and the more money they can make. And so, anytime research, this happened in tobacco, anytime research comes out, this happens with climate change. You can get a whole bulk of studies and then one or two, studies in that are maybe questionable or industry funded, and then they start to say, well, these are equivalent, and so we don't know, whether these are harmful or not, and therefore, just exactly what Talia said, we should postpone regulation because even though you're beginning to mass up a whole weight of studies here, here's one other one that says maybe these are not harmful. And this is what they do by sowing that little bit of doubt in terms of the science. By having a study or two, then we can say, well, we should postpone regulation. And this is where we should tread very carefully. I mean, my own preference would be, hey, we can regulate, and if we find out that they're safe later, maybe we roll those regulations back a little bit or loosen things up. I mean, what's the difference in the regulatory environment? Maybe we ought to start with a safer approach and then allow things, to liberalize as we make determinations that these are a little bit less harmful.
Part of the problem here is that you have a nation that is very polyglot, and so in Europe, where you have Sweden and Norway and Denmark, with a fairly uniform population, where you can have a long-term study, and you can have it with uniform humans. What is the situation in Europe? Do they have some information for us to?
Let me say this about Europe, which I really like. Your European, or actually probably most nations that aren't the United States, we start on the back end with a government that provides health care. So when you start with that, when you start with government-provided healthcare system, you start with a government that's much more committed to public health, prevention, and wellness. That says something like tobacco that's creating healthcare costs, we should work to prevent. The other advantage they have in Europe is the political systems can more effectively regulate because, A, they recognize that this is a problem, and then the political system isn't rooted in this, I'll just call it the Wild West culture of the U.S., just essentially anti-regulation, anti-government feeling. And so almost everybody comes to a policy debate in the U.S. with a libertarian mindset. Says, why do we need a law to do that? And I think that may be uniquely American. Again, I'm not that deeply rooted in European culture, but I do feel like it's an advantage that Europeans have. So both this publicly funded medical system that gives them, to some extent, a stronger orientation to health that might say, we need to regulate this product. Because the bottom line is, a lot of the costs are borne out by us, the taxpayers, through things like Medicare and Medicaid, particularly Medicaid, because as we get into people that are aging with tobacco-related diseases, it can be very costly. And there are lots of studies about tobacco that show the reductions in Medicaid costs that could come from eliminating tobacco among adults because of the tobacco-related disease. So again, show me the money. That's where it comes in. And I think that that's very important. So it's a good point about Europe.
Right. I do know one thing, at least with the UK, the Royal College of Physicians, I believe, did a study and have sort of determined that e-cigarettes should be used as a cessation device, because when we do speak to people who are who vape, or e-cigarette shop owners and so forth, we hear about that particular study a lot, because when we're making the argument that they haven't been approved as a cessation tool yet in the U.S., that we do hear a lot about this study in the UK that shows that they are useful for smoking cessation, and that it is a good harm reduction tool. So I'm not an expert on the European opinion of e-cigs, but I do know that that is something we hear a lot about from people who are vapors here, at least in our community. We hear about that study. So I do think they're looking into it as a cessation tool in the UK. Maybe they're a little bit ahead on that than we are.
Do they control the amount of nicotine in the capsule? Do they have any control?
I'm not sure, but I would hope that there would be some sort of plan in place if this were something that doctors were recommending, that ways that the user can sort of taper themselves off of the nicotine in specific increments using specific e-liquids. I think that's one of the more challenging things about using it as a cessation tool here is that there are no guidelines because they're not approved as a cessation tool. So they're just sort of, I don't know if they're hearing it from friends and family or vape shop owners about how best to taper down their nicotine so that they're not becoming addicted to the e-cigarette in the process. But I think a lot of that's sort of like up for them to just figure out in terms of how they're going to use it to quit smoking, because since they're not approved as a cessation device, I don't think there are clear instructions or guidelines.
I really want to add that, because in the policy world, one of the things we could easily do is to accurately label, because what you really want is an informed consumer. Everybody wants that, whether you're a more libertarian person or whether you're a more government regulation person. Consumer information is the key. I would have e-cigarettes colored in, red, yellow, and green or something like that. Red being the 1 pack a day dose, yellow or other gradations of color where it was prominently marked. I go to the counter, and Talia's probably done this a little bit more. They're not marked. And you can't know. So if a consumer, just at a minimum, and again, whether they're approved or not, just simply knowing, and a lot of young people will say, well, Juuls have 0 nicotine, because they have heard that there are e-cigs that are 0 nicotine. I've heard that too. I guess they're out there. And so they can think that they don't have any. Well, nobody knows. And these are not labeled. And when you look at them behind the counter, it's would be very difficult. And just like the ABV on a beer, if you read carefully, you can see, well, this beer is 3.5 ABV. Well, that one you could probably have 3 or 4. The other one, the Imperial Stout, is 11, so that's like 3 of those beers to 1. Same would be, now you can see ABVs, but they're very hard to find on most beer cans, and a lot of the bars are putting them now. Again, although it does give a drinker a way to maybe regulate their drinking if they want to, again, I would say we should be requiring, so Tobacco 21, one policy approach, limiting the locations in which they're sold, another policy approach. Another policy approach is labeling effectively, just like Talia says. Again, it might not make them a cessation device, but at least it puts the consumer in a situation where they could and where they would know when they were purchasing one that this one, might want to reduce or purchase a 0 if I can.
Yeah, and I'm sure that if you go to a specialty, vape shop, the people employed there would be able to assist more effectively with nicotine content than if you're purchasing your e-liquids from the corner store or, gas station. So that's another sort of, I guess, discussion to be had about where they're sold, should there, licensing, things like that could be put in place.
Is there a poverty situation? We talked a little bit about the Australian Aboriginals. Is there a poverty situation where there's not an education about this? The Australians seem to have done pretty well with with information.
Yeah, Dave and I were having, the 3 of us were having a conversation we were off the air, right? And in Australia and other people among your listeners that have traveled the world might have seen other countries too have packs of cigarettes where at least half or more of the cigarette packaging has really powerful anti-smoking images and messaging. And that's amazing. It's really good to see because A, it creates an informed consumer, and now the consumer can make an effective choice when they know the harm that might come from purchasing this product. So that's wonderful.
To be fairly well educated to pick up some of that information.
Well, sometimes I think if you see a pair of rotten teeth, on your cigarette package rather than like a Cool, which has a waterfall and a forest, you might change your the information that you have. But your poverty situation is well taken. One of the solutions that a lot of people propose is taxation to reduce the level of use. I'm typically opposed to that, only because what you're doing with taxation, when you're taxing an addictive product, you're basically taxing the addict. The addict has a disease or an illness, and just like I would not, the gambling is another addiction when we're taxing gambling. And as you pointed out, Dave, I think it's very accurate to say that these hit the people that are in poverty situations a lot harder because they're just as addicted as somebody with more money, and yet you raise the taxes. Now you've increased the burden and the problem on your lower income people. I mean, you're basically ignoring the fact that that addiction affects somebody whether you make $1 million a year or whether you make $100 a week. And I think that it's a real important distinction, and it's one reason why when people talk about, well, let's just raise the tax, I would say, well, if there are other solutions, we can probably do that. Although I will say taxation does, in the research, it has a demonstrated effect on reduction, particularly among young people, as you've raised the price of cigarettes and tobacco. It has demonstrably resulted in that trend line that you see there with them going down. And yet, with Jules.
Going back to your brain and how it functions, there's a lot of research that's associated with your enzyme body ecosystem, and it seems to me that with cancer especially, there's been an attempt to target the cancer, and the change has been to the immune system, which says the immune system, your whole body, what your age is, what your lifestyle is an influence on the cancer that you might have. So rather than targeting the cancer itself, you target the immune system. You give it a disease, so it acts like an immune system. And remarkably, sometimes the cancer goes away. Is nicotine and vaping, and is it researched for how it operates at the research level? Do we know what the reaction of a body is to nicotine? Is it just your teeth, just your...
Yeah, let me. I'm going to give it to Tali in just a second, but I did when I'm a political scientist, so not a background, not biology, medicine, or medical studies, so I'm a policy guy. But I use research, evidence-based work to inform the policies, and I really look at how policymakers use evidence-based research to make policy choices, and I would like to see that over and over. In the course of some of the research that I've done, I've talked to some toxicologists and cancer researchers who stress that nicotine, if you take all of those other things that are also carcinogenic in a cigarette out and you leave only the nicotine is still a highly carcinogenic chemical in the body. And so nicotine itself results in the development of cancers in the body. And the other thing he told me about nicotine is that it's one of the few drugs that acts as both a stimulant and a depressant at the same time. So it not only relaxes the body, but also stimulates the brain. It's one of the reasons they used it in the military early on, because they found that troops who were tired and not on focus, you smoke a cigarette, calms you down a little bit, but also gives you a little bit of an energy boost, and you can keep going. And the smoker knows that, and that's why it's such an appealing drug, because there are actually few other drugs with that profile. Again, not speaking as a medical researcher, speaking as a political scientist who just has been exposed to it. But I found that to be very, very intriguing in the sense of that. I want to add one more little thing, and that is cancer is only a minor part of tobacco smoking, and the deaths that result, a lot of the deaths that result from traditional tobacco result from heart disease and lung disease and emphysema. A lot of people think, cigarettes do cause cancer, but it's that nicotine
becoming part of an immune system research.
I imagine that it is. I'm not really familiar with that line of research, but
I think there needs to be more publicity about the effects of these drugs on your body, because I don't think people are very aware of that. That's not usually spoken of very much.
I think people have certainly heard all the information about cigarettes. whether or not they've yet heard how, that relates to e-cigarettes, how the nicotine in cigarettes is the same substance as what's in e-cigarettes. And so the issues nicotine causes in traditional tobacco is also a concern with e-cigarettes. And so I just think it's a matter of sort of bridging the two in people's minds, because right now I just think there's sort of a disconnect of, not linking the severity of nicotine in one versus the other. But, with nicotine, I was recently reading some information about nicotine, especially to the developing brain with, young people before 25. And how it can actually affect an individual's impulse control. So it affects, they believe that it sort of affects the brain in such a way that nicotine and other substances become more appealing or more pleasure-causing just from using the nicotine, and that's why they're really looking into whether using e-cigarettes can lead to the use of other substances, because that portion of the brain is being affected by the nicotine.
Does this affect women who are pregnant and smoke? Does this affect the fetus before it's born? The
e-cigarettes, you mean?
Yes, well, either e-cigarettes or tobacco.
Definitely tobacco. I know that they don't, they recommend that pregnant women do not use e-cigarettes because, again, the nicotine and the other substances that we know are harmful in e-cigarettes are certainly going to be harmful for the pregnant woman and the fetus.
So let me
7 minutes.
7 minutes. Is there something you would like to say to wind this up so that you have a message to the public?
Yeah, so the reason that we were initially at the Champaign City Council meeting, and the reason that a study session was planned, was we were advocating for Champaign to include e-cigarettes in the current smoke-free law. So right now, e-cigarettes are not a part of the state law that says you can't smoke in a place of business or within 15 feet of doors or windows. But when that law was created, e-cigarettes were not even on the radar. They were in their infancy, and so it was not a concern at the time, and they have not been added. And so individual municipalities have the ability to improve upon the state law and add additional things to that law if they wish. And so we were advocating that e-cigarettes just be added to that legislation, just to keep e-cigarettes out of public spaces, so that we can reduce the secondhand exposure. We can make sure that we don't re-normalize the act of smoking or vaping, in public for the sake of young people. So that was our main reason for going to the city council, was specifically for that.
I think
But
you did very well.
yeah, I think
I
they
enjoyed
were very.
and I said so. You may have left after the session was gone, but I said I like the idea that you had the industry there selling it. You had people who are users. You had healthcare people who were concerned.
Right, and I think that the city council seemed fairly supportive of the idea.
Yes.
And the even those vape shop owners in the audience. They also believe that young people should not be using e-cigarettes, and that we should find a way to be sure that those who are using them are, legally using them, and that they're informed of the potential harms and helps. And So yeah, from a public health standpoint, our main concern is youth use. We want to, you know, reduce that and implement policies that are going to affect the youth use specifically.
Scott?
Well, we didn't get to say or talk much about one of the things that I'm actually really excited about, and that is the program that Talia mentioned, Engaging Youth for Positive Change. It's something I've been involved with at my work at the Center for Prevention Research and Development for a long time. And I was thrilled to see Talia work with the government class at Centennial, and I really want to acknowledge those young people. I want to acknowledge Talia's work. I want to acknowledge Centennial, a teacher by the name of Bill Behrens, who led that government class. And one of my passions, because like I mentioned, I'm a political scientist, and I love to see young people getting involved in government. They took a leading role at the session that led to this study session and bringing this to the attention. Young people are powerful advocates for change. It benefits them. It benefits the city. It's one of the things I feel really great about. CU PhD has worked both with Centennial and with the school up in Rantoul to bring smoke-free policies to parks, which I think was fantastic also. So this idea of young people getting involved in causes like this and approaching government, affecting policies that make them, is something I'm really proud of, and I really want to acknowledge the Centennial High School kids. Talia is now with another group at Centennial, that working with those kids, and it just makes my heart feel good above and beyond everything else that we've got young people taking the lead here, learning about government, getting involved, especially Champaign City Council. It's amazing to me, and so thanks to everyone involved with that effort.
I echo that.
Does the university support this sort of thing? Is this part of their extension?
Oh, please.
Yes. So actually, one of the few laws we have on the books in Illinois, I'll make this quick, is that tobacco products and e-cigarettes are prohibited from being used on public universities and college campuses. And so that's something that they implemented a couple years ago, and so it's hardly a radical idea. There are even though we don't have a state law currently prohibiting e-cigs in public spaces, there are individual cities here in Illinois that have enacted these policies. So I think that it's a very trending topic and something that's coming down the
Before
pipe.
we're done here, we should give both you guys a chance to tell us about websites people can go to for more information.
Certainly. Yeah, I mean, you can visit Champaign-Urbana Public Health District's website, c-uphd.org, for more information or to find contact information for me or my coworkers to discuss e-cigarettes.
And I'm at the EYPC program is eypc.cprd.illinois.edu, and our Illinois Youth Survey, where you can find information about youth use of both e-cigarettes, cigarettes, and other substances, is iys.cprd.illinois.edu.
So say that again, because that was a mouthful.
Actually, rather than that, we'll put it actually on YouTube, and we'll make sure people can see that when they watch this video of it. It doesn't help people right this very minute, but it's actually also noon, so...
This is Dave Monk, your Prairie Monk, WEFT Champaign, 19.1 on your FM dial, and guests are Talia Shaw and Scott Hayes. And we thank them very much for being here.
Thank you.
And
Thank you, Dave. Great
sure.
to be here.
Dave on the board. It's noon. The views and opinions expressed are solely those of the speakers and no one else.